Hello everyone, and today we'll to talk about how we detect uh, the TMJ directly and need to have a good symptoms to the TMJ and arterial disc and the condyle. So uh, this is called asynchronous movement. Okay, this is called asynchronous movement when the finger is located in the anterior of the auricular. Okay, and the fig and the finger will be rotated like this on the TMJ, so it's called asynchronous movement. Okay, so uh, so asynchronous movement indicate an anterior disc displacement that prevents one of the condyles from making a normal translatory movement. So that means by this movement we indicate with the photo. Okay, that's mean that is indicate an anterior disc displacement. Okay, that prevents one of the condyle from making a normal translatory movement. So that means when the anterior disc displacement have a problem that prevents condyle, so that means this is the condyle and this is articular disc. Okay, that means so in normal position the articular disc with the condyle should be moved together, should be should, should be moved together. So it means while the condyle translates forward, okay, that means the articular disc should be uh, forward. Okay, but in some cases, in some patients, okay, that it means the condyle is not moving directly with the articular disc. So the condyle, for example, moved forward, the articular disc is not moved. Okay, is not moved. That it means the problem with the condyle with the normal translatory movement, it's not uh, happened in this case. Okay, so so auricular palpation auricular palpation, that it means uh, palpation is, it means like this movement. Also it's called asynchronous movement. Okay, auricular palpation with light anterior pressure helps identify potential disorder in the posterior attachment of the disc. Okay, uh, that means auricular palpation in auricular palpation and movement, like rotating movement. Okay, helps to identify. Okay, with light pressure, with light pressure, it means with light pressure. Okay, okay, helps identify potential disorder in the posterior attachment of the disc. Okay, that is the same explanation we just explained that it means this, okay, that this image or this drawing, uh, that is explanation of this sentence. Okay. Okay. Tenderness or pain on movement is noted and can be indicative of inflammatory changes in the retrocervical tissue, which are highly vascular and innervated. Okay, so the pain when the light anterior pressure. Okay, so so the patient feel pain on movement. Okay, that is indicate of inflammatory changes in the tissue, in the retrocervical tissue. That the pain it the pain when the erectile palpation happened. Okay, that is indicates of inflammatory changes in the retrocervical tissue. Okay, which are highly vascular and innervated. Okay, so clicking in the TMJ is often noticeable through our local palpation, but may be difficult to detect in palpation directly over the lateral wall of the condyle process. So that means clicking on the TMJ, when we detect the TMJ, okay, we can find it. It's not it's it's noticeable through through auricular palpation, palpation, rotating movement, like this. We explain it. This is auricular palpation, okay, or asynchronous movement. Okay, so we can detect the TMJ clicking, okay, but may be difficult, but may be difficult to detect in palpation directly. So it's difficult to detect the clicking of the TMJ directly over the condylar process. Why? Because the overlying tissues can muffle the click. Okay, overlying tissues, that means like tissues, for example, this are tissues, and the TMJ, okay, it's looked behind them. I'm sorry, explain it. So for example, this is the TMJ, and this is the tissue. So we cannot detect the TMJ directly by auricular palpation because of the tissue is covered the TMJ, so it can muffle the click. That's prevent the clicking of the TMJ. Okay. Okay. So how we can solve that? So we can solve that. Placement of the fingertips, okay, on the angles of the mandible helps identify even okay, placement the fingertips on the angles, okay, helps to identify the minimal click. Helps identify the minimal click. So rather than placing the fingertips on the tissue that prevents the minimal click or the clicking of the TMJ, we placed the fingertips on the angle of the bone, okay, to provide the minimal click of the TMJ. Because why? Because very little soft tissue lies between the fingertips and the mandibular bone, okay, because there are little soft tissue. For example, we'll explain that this is the TMJ, for example, and this is the soft tissue like this only, so that's helping the clicking the TMJ, okay, without difficulty. A maximum mandibular opening resulting in less than 35 of interincisal movement is considered restricted because the average opening is greater than 50 millimeter. Okay, so we can summarize it. The normal is 50. We can explain it. That is, the normal is 50. The normal opening is 50. Okay. And such restricted movement of on opening can be indicative. Any midline deviation on opening or closing is recorded, so we must record the opening or closing when the midline deviation. Okay, the maximum lateral movement of the patient can be measured. Normal is about 12 millimeter, so we can explain it. The opening is 50, okay, and the lateral movement is 12. These are the normal. Okay. Okay, that is the end of our lecture today. Thank you for listening.